Welcome.
Hi. Hi, Dr. Kernan.
Hi, how are you doing?
I'm doing great, thank you.
Good. So let's. I know gosh, how long have you been going to come to see me?
Over 20 years.
Is it 20 years?
20 years.
Yeah.
Yeah.
Man, you're making me feel old. So tell us what brought you to me. What was going on at the time, and kind of walk us through the years. What's happened since then?
Well, I'm bipolar, and I was having difficulty mostly with mania. And my mania manifests with a lot of manic behavior and compulsive obsessive disorder, but primarily I have trouble a lot with sleeping and just compulsive behavior, shopping, different things of that nature, just compulsive obsessive behavior. And I had really bad luck with other doctors, and it's only with you, Dr. Corona, that I've been able to live a very normal life and participate and have a healthy marriage and work successfully and lead a very normal life and have balance and success in my life, and not be just thrown into a pigeonhole with thrown into different drugs that are just blanketed for bipolar condition, Depakote, lithium, Lithobid, and some of those drugs that are very just mind numbing. But I found a very good cocktail that you put me on, that I've been on for many, many years, and have been able to feel comfortable and have a successful way of life.
And it looks like I know we've had to tweak things along the way and adjust things, and that's kind of part of the process of it. And if we try something that doesn't work, I take it away. And with what I do, even though I've been doing it a long time and I'm pretty good at it, it's all doctors who do what I do. It's trial and error. We think we know. We pretty sure. We try it. Oh, I was wrong. Oh, okay. Well, let me back up. Let me look at it again. Let me try this. There's a lot of that goes on. So you have to be open to changing the course and not being stuck on a and I think so many doctors get stuck and it's like, no, this is the way I treat this. This is how I have to do it. And it's not listening to patients. And when patients are saying no, but then doctors keep forcing it, that's what happens a lot. And the doctors aren't listening to their patients enough. And then that's what gets people in the problems. And I love treating bipolar disorder. It's a challenge. I mean, I like the challenge of it because you have to combine medications. You can't do it with one medication or even two, and oftentimes not even 3 or 4. It takes a combining of different products. I think right now you're on Seroquel, right?
Yeah.
And how many are we at? 600 or 450 or?
I'm between 300 and 600 milligrams. At times, I'm able, because of your direction, to vacillate between 300 and 450 comfortably, and sometimes I go up sometimes to 600 milligrams.
Right.
And because of that flexibility, I'm able to function comfortably. I can go down and regularly stay at 300, or if I need to, I can go up to 450 or 600. And it's because of that flexibility, I'm able to function quite normally.
And you can tell that because of your sleep pattern, right?
Yeah, because of my sleep patterns. And because you've allowed me to sort of titrate on my own, and you've trusted me to make my own decisions based on my need and what my needs are personally.
Right. Yeah, and that's the beauty. I love Seroquel. Great product. But see, I think it's probably the best thing ever for sleep problems, and with bipolar, sleep is often a big problem. You can't shut your brain down at night. and you can't stop thinking about things, and the mind's racing, and you can't. So, and then some, but sometimes, like I said, if it's too high, you're going to sleep 4 or 5 hours. If it's too low, if it's too high, you're going to sleep, too long. And so sometimes that changes during different seasons of the year, times of the year.
Yeah.
Time changes happen. So sometimes we need to adjust it. So I tell people to be flexible with Seroquel. It's not always the same dose, and you have to kind of learn that. And then the other one that really has made a difference with you is Geodon. Tell us about Geodon.
Yeah. Geodon has been a great drug for me. It has given me so much stability. For many years, I was at 80 milligrams, and just recently, in the last 6 months or 4 to 6 months, I have gone up to as much as 160 milligrams, and I've gone up slowly, and that has made the biggest difference in my emotional and mental stability. I'm functioning very comfortably on 160 milligrams. I'm sleeping much better on that. I feel much more comfortable. It's stable on it, and it's proved to be a really good drug for me, much better than a lot of different mood stabilizers that I've tried.
And you're on a high dose of Wellbutrin. You're at 450 Wellbutrin in the morning, right?
Yes, I am. I actually, I take 300 in the morning, and then I wait sometimes till mid-morning or early afternoon to take an extra 150.
Perfect.
And because I'm higher on some of the mood stabilizers, the Seroquel and the Topamax, I don't have the any anxiety side effects of the Wellbutrin. I just have the good benefits of the Wellbutrin.
Well, the benefits of Wellbutrin, the motivation, the energy, the drive, all that. And then, the Topamax, you're at a pretty high dose, but you can tolerate it. You're at 500. I normally stop at 400. I sometimes go up as high as 600 on Topamax.
Yeah.
But you have to be able to tolerate it. Like I said, I said on Topamax, you can get kind of the cognitive, the word finding problems, have you seen any of that, or not problem with side effects?
No, again, these drugs I've been on for many, many years,
right?
And I've gone up on them very slowly and very. I've taken a lot of consideration with them. I've worked up to these milligrams, these higher milligrams. And so I'm up between 500 and 600 milligrams on the Topamax.
Oh, good. So you can get up. You can get up to 600.
Yeah.
Okay.
But I vacillate because you've trusted me with my judgment.
Right.
I'm able to go on it. If I find it's too much, I'm able to go down on it if necessary. I don't necessarily stay at the higher doses all the time, but if need be, I do go up to the 500 and sometimes to the 600.
How do you know? How do you know if it's too much on that one?
If I start to feel a little dizzy on it, or I can just tell if it's a little too much.
Okay.
I do that, but I don't really feel it's too much. Like I said, I've been on it many, many years, so my body has adjusted to a little bit higher dosage. If I had only been on it maybe a year and a half, 2 years, I don't think my body would tolerate it. But I've been on it, over 20 years now. So my body has a very high tolerance for that drug. And
it's also it helps prevent weight gain with potentially with other drugs. So yeah, you're on a great mix here with these products. So if I do say so myself, so great. Well, this is what I love to do, and I again, the fun part of it is figuring these. You have a really great mixture here, which is really fun to see because it took a while to try to get all the dosing right, and things might change. You might notice. My feelings are with you that things are so stable now that we're probably not going to see any earth-shattering changes going on with the med, but we might have to tweak things here and there. But you already know how to do that, and you have a feeling for that already, which is great. So you're helping me. You're helping me do my job. So.
Yes, and I do try to consult with you regularly and check in with you regularly, so that I can stay on track. And like I said, I've been on these drugs many, many years. So if I do feel that something is off, I do try to check in with you regularly on this. So
excellent.
I'm not doing it without counsel.
Well, but I think I'm giving you the wiggle room to do what you do, because you kind of know your body, you know what you can tolerate when. And so it looks like you have a great feel for it. So I'm not concerned about you doing anything, because if you do something wrong or go up too high on something, you'll know. Your body will tell you that it's too much. Yeah. You'll back it down anyway. So,
yeah,
all right.
I do.
Well, excellent. Well, I really appreciate you coming on and sharing your story. Because it's, again, you have a very challenging thing to treat, and most doctors, are just not that good at putting things together. They don't really. They don't know how to combine things in the right way, and they have old. The thinking is very old, and very tired, and they just don't. They're not very often very creative when it comes to medication combinations. And,
No, they're not, and it can be very, very difficult for a person like me with my situation to cope with that, because it could make my life, for me, it can make my life very, very difficult. And very unhappy.
Well, and adding Seroquel and Geodon, some doctors don't understand that. Well, they're in the same category. Why do you do two things? No, you shouldn't do that. You should use lithium or Depakote. That's a classic thing a doctor is going to say, because they're going to say, well, if you're going to add another mood stabilizer, you have to do something in a different class. I do prescribe some lithium and Depakote at times, not as much as I do with what you're taking, but they are good for some people, just not you. And so but I think, like I said, when doctors get stuck in those old modes of thinking, and don't have an open mind to doing things in a different way, that's why patients like you never get completely better, and that's unfortunate, because some people will never the rest of their life ever feel better like you do. They'll get stuck where they are, and then they're not getting out, and there's nowhere to go, and they just feel like, well, that's just my lot in life. That's just the way my life is going to be, and that's that. So very good.
I do feel good, really, most all the time. I would say that I feel good most all of the time.
Good.
I'm not feeling the really high highs and the low lows, which
right.
is really, really a miracle for me.
Yeah.
Really wonderful.
Well, thank you so much for coming on. I really appreciate it. And I'll talk to you soon.
You're welcome. Okay, thank you, doctor.
All right. So in her case, she's got bipolar 1 disorder, which is actually only about 10% of bipolar disorder. A lot of people think bipolar disorder, you have to have mania like she does, like risky behavior, over shopping, sexually, get hypersexual, speeding way too much. I mean, risky behaviors, gambling a lot, too much. So sometimes when you get manic, you get really irrational, paranoid, and that's where she was. When I first saw her 20 or so years ago. So she's on a great combination. So in her case, when you would talk about bipolar 1, you got to focus on the mood stabilizers, not the antidepressants, though that comes second. So in her case, she's on 2 dopamine antagonists. Okay, so she's got 2 medications that slow down dopamine, because that's what she needs in her case. Because when you slow down dopamine, it calms the brain, it gets rid of the mania, it helps you sleep. It just gets that mind. And the problem is, if you do that, what you might be left with is, okay, I'm sleeping, but now I'm tired, I'm not motivated, and so what do I do? If you're watching the show, you know what I'm going to do next. I'm going to add Wellbutrin. Now, so when I put Wellbutrin in, you're not getting only this way, you're also getting this way now. So then now dopamine is going to go the right way. But see, if you do it too much, it's going to cause mania. And if you do it too little, you're going to be tired and unmotivated. So you have to get that right balance of dosing. And that's what, with her case, she's actually on the highest dose of Wellbutrin. And she's also on 2 antipsychotics. And that's working great for her. And the only other thing she's on is Topamax. So with her, dopamine and GABA. And with the Topamax, working on GABA, that's gonna help with the anxiety. It's gonna help with weight loss. And in case any of these medications are causing weight gain, you lose weight. You feel physically better. It gets rid of headaches and muscle tension and pain in the body. So that's why in her case, and she's on a very high dose, so she can handle high doses of things. She has a high dose of pretty much everything she's on is high doses, but it's perfect for her, and she's got the perfect mix going. And so that I love cases like this, because if you don't treat bipolar 1 disorder, like many people don't get it treated, it leads to a dysfunctional life. You can't live properly. You can't hold down a job but well. Your relationships in your life are going to be a disaster. High risk of drug abuse. So bipolar 1's a serious condition. High risk of suicide. And if you don't treat bipolar 1, it's not a good ending. And there's so many people out there who aren't treated and end up in prisons, end up dead from overdose. And so it's a really important, very important condition to treat if you want to save someone's life and keep the person's life functional. So, but she was a really good case. Like I said, I've known her for years. She's a pleasure to work with, and I also see her husband too. Well, hello.
Hello, Dr. Corona.
How are you doing?
I'm doing well today.
Good. Thank you. Thank you for coming on. I really appreciate this. So yeah, if you could share with us your history, kind of what happened with you in the past, what led you to seeing me, and what's happened since then.
Okay. Well, I've been having energy problems. I had some losses in my family. I had some physical problems with my back, and I just had no get up and go. And I'd done therapy and some other modalities, and I just was not functioning. My life, I wasn't able to get to most of the things in my life. And I was really struggling with what to do next. Where do I go? I had been on antidepressants years ago.
Mm-hmm.
That did nothing for me. And a girlfriend had been seeing you, and I saw such a change in her, and she urged me to come and see you. And what I really liked about talking to you is that you were able to zero in on what my problem was, which was a lack of dopamine.
Mm-hmm.
So it wasn't like a general, you're depressed, or it's like, this part of your body is not working. This chemical in your brain is not present. So that's why you can't get up and go. That's why you can't get to these things. And I really appreciated your the way that you went symptomatically with me. So we looked at the symptoms, and that's how you arrived on the dopamine. No, my serotonin was fine.
Mm-hmm.
And before I'd been put on a serotonin antidepressant, that's why it didn't do anything for me.
Right, exactly.
But now I feel like we're definitely on the right track. I feel much better. I feel like I'm getting better all the time. I still have some days where I don't have my energy,
mm-hmm.
and where I'm working out things. But I will say what I appreciate so much about you is that you're there to talk through that. You're there to guide me. Okay, well, let's try this. Okay, well, what's this symptom? Okay, well, let's go in this direction.
Mm-hmm.
And I've never had that before, where I felt heard, to where my symptoms became clear, so they got matched with the right kind of medication.
Right. I think, many doctors, but I'd like to say your get up and go got up and went but a lot of doctors, again, kind of a knee jerk, don't really listen to patients or their symptoms. And then sometimes they don't understand how different symptoms of different histories point in a different direction, because they think, oh, this is first line for everybody. And that's what most doctors do, unfortunately. Now, how about on a recent visit? I think I had I kept you on the Wellbutrin, but I added Rexulti. How has that gone since then?
Well, that's going fine. We played with dosage, went to see what dose was better, and it turned out more is not always good.
Right.
So we came down to a lower function, and it's like a booster.
Right.
Like an energy booster to what my body's being helped to rebuild. And that's kind of what I look at it. The Wellbutrin is helping me function so I can help my body rebuild dopamine on naturally,
right,
to the best of its ability. And then the Rexulti is just a power boost to the Wellbutrin.
Mm-hmm.
And so I have felt so much more energy. I've been able to work more, been able to do more household chores. Still working up to getting out and being more social. But I definitely see the trajectory going in the way that I want it to go. Where before I felt more, I felt hopeless. Like, I've tried this before, it didn't work. I've tried all these other things. And then I was introduced to you, and it's like, oh, I found hope again.
Yeah, I think there's that. Hope is a word that I love that word, and it's I think so many people get discouraged, and unfortunately, if they're not treated properly, there's a lot of people who give up, and there's a lot of people who don't really, or they say, oh, go see another doctor. Oh, I've already tried that. I've been there, done that. It doesn't work for me. Well, maybe what you tried before didn't work for you. Maybe there's a different way to go. But unfortunately, like I said, there's so many people out there suffering, and they feel hopeless because they feel like that's it. I've already tried this or that, and nothing works for me, and that's sad. It makes me sad knowing that there are so many people out there like that, and I wish I could reach everybody, and I can't, and that's frustrating to me because I want to help as many people as I can, and hopefully with the help of this show, and gonna hopefully reach my goal of reaching more people and getting the word out about this.
Right, exactly. And I think, too, for me, it wasn't just becoming hopeless. It was becoming to believe there's something wrong with me.
Right.
Like, there's something wrong with me, that it's not working for me, that it says it works for other people, whatever was being tried on me.
Right.
But it wasn't working on me. And then I was feeling bad about myself on top of it.
Right. You're feeling like there's something you're not doing or something. There's something you're not, like it's your fault somehow.
Yeah, exactly.
Right.
Exactly. And it's just come down to I hadn't found you. Right. I hadn't found the right place to look at what was really going on.
Mm-hmm. Well, great. Well, thank you so much. I really appreciate you coming on. And again, I hopefully, again, I'm gonna after I get off the phone with you, I'm gonna talk about dopamine on my whiteboard here. Okay. But in explaining the fact that what these are doing there, it's working with balancing your own dopamine level, and I look at it. This is the real you. The real you is when this chemical is balanced properly. And people say, well, this isn't the real me. This is the real me on medication. Well, that's not how I look at it. I mean, you can make the argument with a diabetic. Well, the real you is when you're not shooting insulin in your body, and they're like, well, what are you talking about? I need to survive. That's how I survive. And it's like, oh, but yeah, but you should just eat better. Well, it's like, no, it's not that kind of diabetes. So it's the same argument as like, it's not the real person, the person who treats the diabetes or the thyroid condition or whatever. Of course, this is the right person. It's just a healthier person, and you're at a point now. The medications aren't going to do everything. They're going to get you to the point where you're more likely to be able to get up and socialize and exercise, and it's still going to take it still takes the work of a person to take it to the next step. But it allows your body to be able to, it allows you to be able to actually do it, because without treating these imbalances, it just makes life so much harder,
Well, I couldn't do the things that I needed to do to create more dopamine.
Right.
I was just so depleted, and so the medication has given me the enough get up and go so that, as I said earlier, I can try to do those things that can help increase it naturally. Yeah.
Excellent. Well, thank you so much for coming on. I really, really appreciate it.
Oh, you're welcome, Dr. Corona. Thank you for all you do.
Okay. Talk to you soon.
All righty.
All right.
Okay. Bye-bye.
So in her case, again, before she saw me, again, doctors, again, SSRIs, that's all they think. And even despite her symptoms, which to me were obviously having to do with dopamine, for them, they just, gave her that. And the problem, you give her SSRI, is just going to make everything worse. It'll make her more tired, more apathetic. So with her, it was easy. The first appointment with her, I gave her Wellbutrin, a little bit of norepinephrine, not a lot, but a little bit, more dopamine. So again, it's not adding dopamine. She's not, I guess you could call it deficient in dopamine, but because what's deficient is the fact that it's not moving properly. So when we put this in and it stops the leaking here, then that means dopamine can move forward. A little bit of norepinephrine too, which is always good. And that's why. And then I think I tried other things for GABA with her. It didn't work. So then when she came and saw me, and she said that it was kind of, I tried already increasing it, the Wellbutrin to 300, which is average, and it didn't feel good. So I went back to 150 on her, which is the lowest dose. But I knew there was something missing because she was having anxiety. She felt that the Wellbutrin wasn't working as well. So I added Rexulti, which I use a lot of. Okay. So what that does, it works also on dopamine. It basically is we can look at it as a dopamine booster, like she said. Sometimes it just helps to modulate and helps to add that one piece there to help dopamine flow even better. So sometimes, again, it's with a lot of patients, I put things together. And you're going to see commercials about ask your doctor about adding Rexulti to your antidepressant. Exactly. So when people get to the point where the antidepressants aren't getting them there, they're getting them closer, but they're not there, that's when adding a little bit of a mood stabilizer helps. And Rexulti is a good one. It's very gentle, easy on the system. In her case, actually, the average dose is usually about 1 to 2 milligram. In her case, it's 0.5 milligram, which is very unusual that someone is going to respond to that low of a dose. She did. She's on a 0.5 Rexulti, 150 Wellbutrin, both very low, both about half the average dose of most adults, and she's doing great. And so again, she's not doing is getting her there. She said that she still has to work on the being social part and getting out to exercise more, but it definitely lays the groundwork for her to be able to do those things. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of the Dr. Paul Show.